Ever wondered what happens in your body during a heart attack? Well, let's dive into it. Picture the heart. It's a mighty muscle, a tireless performer, pumping blood throughout your body, delivering oxygen and nutrients to every cell. But what happens when this powerhouse encounters a hurdle? A heart attack occurs when blood flow to a part of the heart gets blocked, usually by a pesky blood clot. This interruption can injure or even destroy a portion of the heart muscle. It sounds scary, right? It can indeed be fatal. But here's a bit of good news. Over the years, treatment for heart attacks has seen tremendous improvement, increasing survival rates and outcomes. So, while the thought of a heart attack might be daunting, remember, we're living in an age of medical marvels. Now that we know what a heart attack is, how can we respond if one occurs? Stay tuned to find out. So, how do you know if you or someone else is having a heart attack? This question is pivotal, and understanding the answer can save lives. Heart attacks often present themselves through a range of signs. A classic symptom is chest pain, which might feel like a squeezing, pressure, or discomfort. This pain can radiate to other parts of the body, including the arms, neck, jaw, back, and stomach. Shortness of breath is another common indicator, even without chest discomfort. However, it's important to remember that symptoms can vary greatly from person to person. Some individuals may not experience any symptoms at all, making it even more challenging to recognize a heart attack. If you suspect a heart attack, don't wait. Every minute counts. Seek immediate medical attention. Quick response can significantly improve survival rates and recovery. Recognizing a heart attack is crucial, but what should you do next? If you suspect someone is having a heart attack, what's the first step? A question many of us may stumble upon, but the answer is crucial. The very first step is to call your local emergency services immediately. Time is of the essence in a heart attack scenario, and every second counts. While you wait for medical professionals to arrive, you may be the victim's best hope. It's here that cardiopulmonary resuscitation, or CPR, could be the difference between life and death. CPR is a life-saving technique that can help maintain the flow of oxygen to the brain during a cardiac arrest. The importance of this cannot be overstated. It's a skill that everyone should know. Remember, you're not alone in this. The emergency services operator can guide you through the process. Be sure to stay calm, listen carefully, and follow their instructions. But how exactly do you perform CPR? Let's find out. Performing CPR can seem daunting, but it's simpler than you might think. It's all about maintaining the flow of oxygenated blood to the brain and other vital organs until medical help arrives. Let's break it down. CPR, or cardiopulmonary resuscitation, consists of two main steps: chest compressions and rescue breaths. Step 1. Chest compressions. Here's how it's done. Kneel beside the person who needs help. Place the heel of one hand on the center of their chest. Place your other hand on top, interlocking your fingers. Keep your elbows straight and use your upper body weight to push down hard and fast. You're aiming for at least 100 to 120 compressions per minute, to the beat of a fast song you might have in your head like "Stayin' Alive." Next, rescue breaths. After 30 chest compressions, give 2 rescue breaths. Tilt the person's head back slightly to open the airway. Pinch the person's nose shut and breathe into their mouth until you see the chest rise. And then, it's back to chest compressions. Continue with cycles of 30 compressions and 2 rescue breaths until you see signs of life or until medical help arrives. Remember, the goal of CPR is not to restart the heart, but rather to restore partial flow of oxygenated blood to the brain and heart and to delay tissue death. It's about buying time, precious time that can make all the difference. It's also important to note that if you're untrained or unsure about giving rescue breaths, hands-only CPR can be just as effective. Just keep pushing hard and fast in the center of the chest. Performing CPR might feel overwhelming in a crisis, but your actions can truly make a difference. You have the power to help someone in their most critical moment. With these steps, you could potentially save a life during a heart attack. We've covered a lot today, so let's summarize. Heart attacks can strike anyone, anywhere, and recognizing the signs early is crucial. Chest pain, shortness of breath, and discomfort in other parts of the body are key indicators. Once these signs are identified, swift action is vital. Call emergency services and, if necessary, perform CPR. Press hard and fast in the center of the chest and don't stop until help arrives. Remember, your knowledge and quick action could be the difference between life and death for someone experiencing a heart attack.